Hi everyone! I have this amazing, interesting topic that I'm about to discuss with you, but before I do so, I'm gonna ask you guys a few questions. Number one, have you experienced panic attack, anxiety, fear? Number two, have you experienced no enjoyment in your hobbies or activities you usually do enjoy? Number three, have you been having trouble concentrating or getting your tasks done? Number four, have your sleeping habits changed? Well, if you answered yes with all of these questions, don't worry. I'm going to talk about nervous breakdown. You're wondering, what does nervous breakdown mean? So let's get started. The nervous breakdown is sometimes used by people to describe a stressful situation in which they're temporarily unable to function normally in day-to-day life. It's commonly understood to occur when life's demand become physically and emotionally overwhelming. The term was frequently used in the past to cover a variety of mental disorders, but it is no longer used by mental health professionals. Now, nervous breakdown isn't a medical term, nor does it indicate a specific mental illness. But that doesn't mean it's a normal or a healthy response to stress. What some people call a nervous breakdown may indicate an underlying mental health problem that needs attention, such as anxiety and depression. Now, what causes nervous breakdown? Nervous breakdowns are caused by your body's stress response. In some cases, your body reacts inappropriately to stress, or you are faced with so much stress that your body cannot react appropriately. In these cases, you can feel excess anxiety that can lead to a nervous breakdown. Nervous breakdown can happen because of abnormally stressful situations or long-term high stress levels. They can also result from certain medications and substances. In most cases, however, nervous breakdowns are related to an anxiety disorder. Now let's go to what are the different types. Nervous breakdown caused by an underlying anxiety and depression. Let's go on with anxiety. Anxiety disorders are the most common mental illnesses, and many people live with one without being treated. Specific anxiety disorders include generalized anxiety, social anxiety, and panic disorder. These conditions are characterized by excessive worry and feelings of anxiety that persist. Anxiety can cause a lot of distress, dysfunctions, physical symptoms, and trouble thinking. Not managing anxiety and having stress can be a recipe for a nervous breakdown. Let's get on with depression. Is another very common mental health condition, and when left untreated, could trigger a nervous breakdown. Someone with depression feels persistently sad and hopeless, is fatigued and unable to summon interest for normal activities. Like anxiety disorders, this condition can make it very difficult to function. When not treated, the struggle to cope with the low mood as well as any address can lead to a breakdown. Let's head on to burnout syndrome or work-related breakdowns. A mental breakdown can be caused by a number of factors, but for a lot of people, stress from work is a major sole cause. Some professionals refer to a work-related nervous breakdown as a burnout syndrome. The symptoms of burnout syndrome include three main signs that mirror what anyone experiencing a nervous breakdown of any type goes through. Number one, extreme exhaustion and fatigue. This is often related to putting in long hours, but can be both physical and emotional. People who care for others, for instance, in the healthcare field, may experience a lot of emotional fatigue. Number two, poor performance. As with any type of nervous breakdown, burnout syndrome leads to poor performance at work. The low performance may trickle into other areas of life as well. Number three, Feeling depersonalized. Work stress can lead into an indifferent or a cynical attitude toward work and may cause an effect that seems impersonal or uncaring. Now, nervous breakdown with psychotic symptoms. A psychotic breakdown is any nervous breakdown that triggers symptoms of psychosis, which refers to losing touch with reality. Psychosis is more often associated with very serious mental illnesses like schizophrenia, but anyone can experience these symptoms if stress becomes overwhelming, triggering a breakdown. A common type of psychosis experienced during a nervous breakdown is a feeling of detachment or depersonalization. A person may feel as if they are not really a part of any given situation, like work and family. This can also make someone feel as if they are not really themselves. Symptoms may include hallucinations, sounds, or images that seem real but aren't really there, as well as delusions and paranoia. These last two may take the form of being irrationally suspicious of friends, family, and other people. Now, what about panic attacks? Panic attacks come on suddenly and without warning. They are shorter lived than nervous breakdowns, and when they pass, they can leave a person feeling fatigued or stressed. While some people who have panic attacks may not have a lot of stress in their lives, these attacks can be triggered by a lot of stress. Just like nervous breakdowns, panic attacks are very frightening because of how sudden they are and because they cause a lot of physical symptoms. Now, let's go to what are the symptoms of nervous breakdown. Regardless of factors that make a nervous breakdown different from one person to another, there are some common signs and symptoms. These symptoms can be emotional, behavioral, and physical. Let's get on. Number 1, feeling of depression or anxiety that are new or more overwhelming than before. Number 2, feeling overwhelmed. Number 3, shutting down and being unable to participate in normal activities. Number 4, missing appointments, work, school, and other responsibilities. Number 5, trouble thinking, concentrating, making decisions, or getting tasks done. Number 6, being socially isolated and withdrawn. Number 7, experiencing mood swings that may be extreme. Number 8, decreased self-care like hygiene or personal appearance. Number 9, changes in sleep habits. Number 10, changes in eating habits causing weight loss or weight gain. Number 11, extreme fatigue or apathy. Number 12, unexplained pains or distress. Number 13, getting sick more often or worse than usual. Let's go on to how long does a nervous breakdown last? A nervous breakdown, which is a loss of the ability to function in everyday life, may last for a few hours or a few weeks. The duration of this type of mental health crisis depends on the individual and factors such as the amount of stress leading up to the breakdown, coping strategies, timing, and quality of treatment, any undiagnosed or untreated mental illnesses, and the state of social support system. Good. Timely treatment can help minimize the duration and severity of a nervous breakdown. Let's go on with the duration of nervous breakdown varies by individual. Now, there are many risk factors for having a nervous breakdown. And the more individual has, the greater the chance that a breakdown will last longer. These risk factors include: number 1, an undiagnosed and untreated mental health condition, often depression or anxiety in the case of a nervous breakdown. Number 2, having a lot of responsibilities at home, at work, or in other areas of life. Number 3, a traumatic, stressful situation such as divorce, chronic illness, or abuse. Number 4, having no poor strategies for dealing with a stressful situation. Number 5, having negative coping strategies such as substance abuse. Number 6, having a type A or perfectionist personality. Number 7, being unable to let go of control or to delegate others. Number 8, lacking good social support and a healthy social life with close friends or family members. Lastly, number 9, not taking care of personal health, including sleeping too little, eating a poor diet, or not getting enough exercise. Now, a nervous breakdown may also vary in severity, which can impact the duration of the episode. A less severe breakdown that leads to deterioration in function but not total loss of function may go on for some time before a person seeks help. A severe crisis, on the other hand, may be shorter in duration, while recovery treatment will take much longer. Now, how about let's move on to recovery from a nervous breakdown. Following a nervous breakdown, a full recovery is possible. While not a medical term, people use this expression referring to someone who is being overwhelmed by mental health issues. Treatments may include medicines and therapy, depending on the situation though, the diagnosis and the patient's wishes. Now let's go for tips on recovering or from recovering a nervous breakdown. Number 1, simple lifestyle changes can help deal with stress and anxiety. A healthy diet can improve energy levels, sleep habits, and help to combat illness and prevent you feeling low and tired. You might also remove stimulants from your diet such as caffeine. This can help reduce anxiety and improve sleep. Number 2, exercise can help many forms of temporary and long-term mental illnesses. Exercise can be used as a way to do something for yourself and provide time out from other pressures. Team sports or activities encourage socializing, which can reduce feeling of isolation, give your mood a boost, and increase self-esteem. Physical fatigue may also improve sleep, which is essential to give you energy to cope up to day-to-day activities. Number 3, learning relaxation, such as meditation or breathing exercises, might also help and can be practiced when you feel your stress levels are rising. Lastly, number 4, get to know the signs that indicate that you're struggling to cope. If you can recognize the signs of a nervous breakdown, then you can take action and ask help before reaching a breaking point. In some cases, a nervous breakdown may indicate more serious mental health issue, such as anxiety disorder or post-traumatic stress disorder, in which cases, medicines and therapy may be required for aid recovery. Now, before I end my discussion with you guys, I'm gonna give you guys 4 ways to help someone having a nervous breakdown. Let me get started. When you suspect someone is having a nervous breakdown, you must take it very seriously. A nervous breakdown may cause an individual to stop normal functioning, as well as an array of the other side effects. It is important you understand what a nervous breakdown is, the early signs, and how to help someone who's having a nervous breakdown. When someone is experiencing a nervous breakdown, it is essential to make sure help is available, as overcoming this mental health is very challenging. The main symptom of a nervous breakdown is the inability to function normally, and may include not being able to ask for help. Someone going through a nervous breakdown may have thoughts of self-harm or suicide. If you feel overwhelmed in helping, do not be afraid to call for help when in doubt. Here are some tips to help someone who's going through nervous breakdown. Number 1, create a safe and a calm environment. Make sure both physically and emotionally the individual is in a safe place. Take away distractions and unnecessary things. Number 2, listen without judgment. A person enduring a nervous breakdown will be much more likely to listen to you if you approach them with calm, non-judgmental attitude. Number 3, encourage treatment. Since the cause and the severity of a nervous breakdown is different for each person receiving diagnosis from a mental health professional, key is the treatment. This mental health crisis will not get better on its own. It is challenging though, so make sure they speak up to a professional. Lastly, number 4, help them make lifestyle changes. Adjusting just a few things in life can really help a person cope up with stress, anxiety, nervous breakdown in a healthy manner. Make sure they're practicing self-care to encourage exercise. Well, that's my topic for today. I hope you guys learned so much. Thank you!